Hi, this is Dr. Paul Goldberg of the Goldberg Clinic in Kennesaw, Georgia. Today, we're very happy to have Marjorie Browning with us. Marjorie has been a patient of ours for about 2 months now, right, Marjorie? Yeah. And Marjorie came in, she is from Powder Springs, Georgia, local. And Marjorie came in 2 months ago with what problems did you have, Marjorie, when you first came into our clinic?
Well, last year I almost died twice. I had septic shock, I had a stent in my heart, and I had a heart attack when they put the stent in.
That was how long ago?
That was about a year ago.
About a year ago.
And diabetes, high blood pressure.
How long have you had the diabetes for, Marjorie?
10 years.
10 years, so it's been quite a while, a full decade.
Yeah.
Mm-hmm. High blood pressure. Okay.
Obesity, for sure.
Obesity. It's quite a laundry list there.
Yes.
How were you feeling when you first came into our clinic?
I was short of breath all the time. I walked to the kitchen, get out of breath, couldn't get up the stairs. I have a horse, I saddled a horse, but I was too tired to ride.
You have some property, it's in Alabama, am I remembering right?
Yes.
Right. You have horses there, cows, chickens, got a real farm there.
Mm-hmm.
Uh-huh. And so you were having trouble keeping up with your daily activities.
Yeah.
Right. What were they doing with you medically?
Medications.
How many different drugs and what drugs were you on?
Oh, I was on, I think, 4 blood pressure medications.
Four medications just for blood pressure. Okay.
2 types of insulin.
2 types of insulin.
2 other drugs for diabetes.
So we're up to about 8 drugs now.
Depression.
You're on an antidepressant.
And Lipitor.
And Lipitor. Okay. When we started working with you, Marjorie, your blood sugars were going up and down quite a bit. What did you discover? Because you've been very much involved in your care, which we like to see. What did you discover was one of the factors that was causing big shifts in your blood sugar levels?
Well, I took my Lipitor at night before I went to bed, and I couldn't get blood sugar down in the morning. I'd go to bed and it would be relatively normal, and I'd get up and it would be like 350.
Right.
And when I stopped taking Lipitor, the next day it dropped 50 points.
What's been the consequences or the sequela of that since then? What's happened? What have you discovered then?
That there's a class action suit against Lipitor for causing type 2 diabetes. And I started taking Lipitor before I was diagnosed with diabetes.
You had been on Lipitor before you were diagnosed with diabetes. In your opinion, would you say that Lipitor played a contributing role in your illness?
I would say definitely.
You would say definitely. And now that you're off Lipitor now,
yes.
And have your blood sugar levels, has that been one factor in your blood sugar levels stabilizing, would you say?
It has been one of the factors.
Been one of the factors.
I still have high morning sugars, but my high morning sugars now 130 to 140 instead of 350.
130 or 140 rather than 350. That's a remarkable improvement. And you also had your hemoglobin A1C. Your glycosylated hemoglobin was originally at 11.7, and that's dropped also, hasn't it?
Yes.
Dr. Tenner said it was down to about 9 now. Right.
And I'm having it done next week.
So. You're having it done next week, so let's see where it's at right at that point. Your triglycerides, this has only been 60 days, and you were on Lipitor. But now that you're off Lipitor, your triglycerides have dropped from 472, which is incredibly high, down to 206. And we also did a HSCRP, a high sensitivity cardiac reactive protein on you, which is a measure of inflammation. And you had a heart problem, had you not?
Yes.
Yes. Had a stent put in?
Yes.
Had you been in the hospital for cardiac incident?
Yes.
Yes. And so you were at very great risk of heart attack, stroke, and just in those 2 months, your high sensitivity cardiac reactive protein has gone from 8.8 down to 4.0. It's just slightly above normal now. When you first came in, it was about 3 times what it should be. So that alone indicates that your risk for having a future heart attack has diminished considerably. You're off Lipitor now, and your blood pressure. Your blood pressure when you first came in was 160 over 90. It's now 124 over 60. Pretty remarkable improvement there. That's just in 60 days. Tell me and our audience, what changes have you noted in the way that you feel? And you're off antidepressants now, too.
Yes.
Tell us what changes you've noted.
Well, we have a farm, and I cleaned stalls all day one day this week. And before, I couldn't clean one stall. And now I run up and down the stairs. I do aerobics 4 nights a week. I have plenty of energy. I feel good. I'm sleeping better.
And you're a person that likes to do things, I know.
Oh, yeah.
Yeah.
Oh yeah, we have a lot of, we've got horses and cows, and there's always something.
And grandchildren.
Yes, 2 grandchildren.
Yeah. So you were really kind of had a huge saddle on your back. We took a woman who likes to be active, likes to do things, and it was limiting your activity.
Oh, severely. That's why I came here.
That's what it came from, yeah.
Because I'd been to all the doctors, and all they did was give me medication.
10 different drugs when you came in.
Anytime that I went in there, they said, well, take this and you'll feel better. And I started realizing that every time I started taking something else went wrong. It was either my stomach was upset, or the interaction between the drugs must just be horrendous.
Yeah. And there were 10 of them, so there were certainly lots of opportunities for interactions. And you've reduced the number of drugs you're on. You've made incredible improvements. We're only 2 months into this. So we're looking forward to continuing improvement for you, Marjorie. And the major reason for your improvement is not just because of Dr. Tenner's and my genius. The main reason for your improvement is because you are a very dedicated and disciplined person.
Well, he's quite an encourager.
And Dr. Tenner is a great encourager. And
even my heart doctor, when I called to ask if I could go off some of the medication, because Dr. Tenner told me to make sure that the doctor was okay with me going off the medication, he called me back. My heart doctor called me and said, I am so proud of you. I am so excited for what you're doing. So even he was thrilled with the progress.
Well, Marjorie, we're very proud of you and the efforts that you've made, which have been incredible. We're only 2 months into this now. You've already made tremendous improvement. We're looking forward to ongoing, continuing improvement with you. Thank you very much.
You're welcome. Thank you.